I think clinicians have a good understanding that the illness that we see comes from the community around us, and that there are social factors there that need to be addressed in order for our interventions to be impactful.
A lot of things nowadays can't be solved with a pill or with a therapy or with an intervention that can be provided from a medical standpoint or medical point of view, but it can be helped by someone who just is able to sit and listen to some of the difficulties that they have and sort of point them in the direction of where they can get help.
A community link worker is someone who is embedded in the community, has a good understanding of all the resources and networks and support that's available in the community, and can work with our patients to help them with whatever issues they're having, which are more from a social point of view than a medical point of view.
So a link worker is worth their weight in gold because they can work with a patient to link them to that thing that needs to happen, whether that's getting the housing issues addressed or whether it's joining a walking group. And because the link worker is involved, that is much more likely to happen.
We've noticed a great benefit to the patients at our practice. We'll make referrals for issues such as help with navigating the benefit system, or perhaps finding some support for getting out the house, things that we maybe don't have the expertise of as GPs, but the link workers do have expertise in. And then what we find is working with the patient over weeks and months, this can be transformative for their health and well-being.
We provide a lot of different services for the community. It's not just about healthcare, it's about social care as well, and the community link workers are a huge part of that. To get to the root of their medical issues, it's maybe social issues, and that's what the community link workers are there to help with, whether it be anxiety or stress or financial or housing.
It's about making the whole network easy to navigate for patients, but there will always be that very vulnerable 5 or 10% of our population who are going to need a link worker to help bridge them into those local services.
I often see people falling through the cracks, and it's the most vulnerable people who are most likely to get the most benefit from these link workers.
They're just such a resource, and they're just such an integral part of every practice team. Every practice should have one, and they should have one for more than one day a week. It needs to be driven forward, and the message needs to get out more.
I don't think it's any great secret that primary care has been a difficult place in recent years. The NHS has been a difficult place, and this is one of the really positive interventions that have happened. And we enjoy working with our link workers, and we enjoy the breadth of work that brings into us, and it really is effective and helpful for our patients.
I think it's very clear how much of a help they are to our patients, how they can protect the NHS as well, the resources we have. What we really need to see is long-term funding rather than 6-month, 12-month funding at a time. We need a long-term commitment so that the people who work as link workers can get the stability they need to provide the best service, and so that we can, as a practice and as a health service, plan around patients getting that help that they need.
The use of link workers makes a huge difference to people, particularly health inequality. And we hear it bandied about poverty kills. Well, it does, and this is a group of specialists whose job it is to try and reduce that impact. So the network really needs to push that agenda at the government level and make sure that their voices are being heard, and make sure everybody understands what it is that they do so that people can utilise it.